Assalamu alaikum. Today we will be studying the diseases of the external ear. So we'll see what are they, what are different types of diseases and how to tackle with them. First of all, we'll be seeing at the diseases of the external uh, most external part of the ear. So let's see, anotia, meaning the complete absence of the ear pinna. See, there is no pinna here at the face of the girl. Then microtia, meaning small ears. Okay, this is microtia, the ears are small. Okay, and macrotia, meaning excessively large pinna. Bad ear, meaning the pinna looks like a bat ear, pin of a bat. Okay. Then there's the important, uh, here you go. This is appendages. This is an appendage. This is cauliflower ear or pugilistic or box's ear due to a trauma. This is infected periauricular sinus, and this is pus flowing outside. And this is the laceration due to some cut or trauma. Okay, and this is keloid formation due to the piercing, due to use of a piercing, and after the piercing of the ear. Okay, this is the inflammation of the cartilage, and it is quite painful on touch. So there are different inflammations of the ear canal due to bacteria, fungi, or viruses. Bacteria can cause furuncles, meaning local otitis externa. Otitis means inflammation, externa means of the outer ear. Diffuse otitis externa meaning diffuse meaning everything, it is covering everything outside, okay, like it's diffuse. And malignant otitis externa, okay, this is the condition in diabetics and only specific for diabetics. In fungal, this is called otomycosis, and there are three terms with auto. First is auto toxicity, okay, ototoxicity. Second is otomycosis, meaning fungus, and third is otosclerosis, meaning it is the hardening of the oval window or round window. So you should differentiate between the three of them. These three are different terms. Okay. So we were on our topic of viral. It can be caused by herpes zoster oticus or otitis externa hemorrhagica. So we'll study the furuncles first, meaning the infection of the outer ear, acute otitis externa. Basically, it is caused by Staphylococcus, okay, and it attacks the hair follicles, and it is seen on the cartilaginous part of the meatus, and it can be multiple in number. A patient is in severe pain and tenderness, and the movements of pinna are painful. Jaw movements as in chewing also cause pain, and edema over mastoids can be present. The lymph node may be enlarged. The treatment is of systemic antibiotics like vibramycin or analgesics, meaning painkillers like brufen, and local heat, meaning you can provide it heat. And it can be in case of recurrent furunclosis, meaning it's occurring again and again. Diabetes should be excluded, meaning the person can have diabetes and a good doctor should exclude it for him or her for diabetes. um The patient nasal vestibules can be harboring the staphylococci, and the infection can be transferred by the patient's finger. The patient should not put fingers in his nose. Okay, then there's diffuse otitis externa. The most important point in it is it is also called the swimmer's ear, and this is the most important differentiating point because they're always swimming and the water is going inside their ears, and the environment is hot and humid, so the excessive sweating changes the pH of the meatal skin from acid to alkaline, from acidic to basic, which favors the growth of pathogens. The two factors which are important to consider are trauma to the meatal skin, and trauma can be caused by you too, or an invasion by a pathogenic organism. First of all, a trauma can result from scratching the ear with your uh, nail, or your hairpin, or mastics, unskilled instrumentation, which should not be done by an unskilled person. You should not be cleaning your ears by yourself. Okay, it, you can damage your skin, and the epithelial layer can damage, and the bacteria can easily get inside. So, common organisms responsible are Staphylococcus, Pseudomonas, and the Bacillus in Escherichia coli. So, in some cases, otitis externa are secondary to infection of the middle ear, or if there's problem in the middle ear, it can slowly spread to the external ear as well, or the mastoidea cells, and allergic sensitization can be also caused. So clinical features are can be acute or chronic. In acute phase, there is a hot burning sensation followed by pain and oozing, and then there is inflammation and collection of debris. And meatus swelling can also give rise to the conductive hearing loss because the meatus is getting smaller. Low waves are entering the ear, and this can cause otitis externa. Wait a minute. Okay, so sorry for that. My speaker started speaking. Okay, so it in chronic phase, it can be characterized by irritation and strong desire to itch. Okay, discharge is scanty and may dry up to form crust. This is an important point. Okay, the treatment can be ear toilet, meaning we can wash the ear. Okay, and medicated wicks, this cotton bud with antibiotic on it. Okay, and steroid as well, 2 to 3 drops a day for 2 to 3 days. And local steroid helps controlling the inflammation, and silver nitrate can be used as well. Antibiotics, broad spectrum antibiotics like doxycycline can be used, and for analgesics for relief of pain. Tobramycin can be used as well. Okay, automycosis, meaning fungal infection of the ear canal. It can often occur due to Aspergillus niger fungus, or Candida albicans. It is seen in a hot and humid environment. The clinical feature can be intense itching, discomfort or pain, watery discharge, and ear blockage. If we examine it with the otoscope, it appears black. This is an important differentiating point, that it appears black on when seen with the otoscope. Fumigatus as pale blue and Candida as white. Candidas are always white. Okay. Treatment can be either toilet or a suction can be done. Nystatin, a fungus killer, can be used. Okay. So let me show you the pictures now. As you can see, let's go to the external ear, the pinna. First of all, we start with the minor deformities. Okay, so here are minor deformities with this is um, duplication of the lobule. See, here's one lobule. This is the second one, and this is an accessory lobule. Okay, this is Darwin's tubercle, just like this. This is microtia, small ears. Okay, small pinna, and this is the surgical reconstruction of the pinna. Very nice one. Okay, this is the bone anchored prosthesis, and this is a fake ear. Okay, this is periauricular sinus with pus. Okay, this is furuncles. These are furuncles. Okay, and this is the excision of the furuncles. This is bat ear, prominent ears. Okay, and this is the surgical correction. These are all bat ear patients, familial bat ear patients. Their father was bat ear. This was a prominent ear and it was surgically corrected and it looked like this in the end. This is a keloid formation due to the use of a piercing or ornaments common in Africans. This is a keloid again. This is a granuloma cancerous, or this is the nickel sensitivity type 2, I guess, or I don't remember. Um, this can be a trauma. This is due to a piercing. This is trauma as well. Assist um, due to trauma. This is due to trauma. This is cartilage inflammation due to the pseudomonas. Okay. Um, Not important. This is due to the herpes zoster. This is basal cell carcinoma. Okay. Let's see the. Okay, this is the syringing. This is the ear toilet. They are washing it with the water. See, they're washing it water. This is a foreign body present. A tick foreign body can be present as well. This is a furuncle again. Furuncles again. Otitis externa. This is otitis externa as well. Otitis externa. Malignant otitis externa in diabetes patients. Okay. Let's go back to our topic. Okay, these types are not very important. There can be also hepatic bags. Okay, um, meaning that the wax was collected too much in the air and it started obstructing the voice going inside the tympanic membrane, and the person started hearing less and less day by day. It should not happen usually. Normally the wax is like cleaned by body or by yourself, so it is not impacted usually. So let's move forward. There can be foreign bodies. So they're using the irrigation method here to clean. This is old method. Now there are section methods, just like a vacuum. You pull outside this foreign body with the vacuum. Okay, they can be used by forceps, remove by forceps, syringing, suction. This is the most common use method these days. Microscopic removal with special instruments and post-oral approach. This is insect inside someone's ear. Okay, now we'll cover the rest in other videos. Thank you for listening.